Can we then welcome on stage the Premier of Northwest, Professor Job Mokgoro, to speak words on behalf of the provincial government. Over to you, Prof. Matsoho.
Thank you very much, Program Director. His Excellency Deputy President, the Minister of Health, Dr. Mkhize, the MEC for Health, and other MECs here, Deputy Ministers, Khositsaruna, Bakhaye Chudumelang. I'll be very brief in the interest of time. You have been told several times that we have managed to re-establish the PCA, the Provincial Council on AIDS. And our commitment is to ensure that the entire structure throughout all the levels in the province will ensure the appropriate political leadership. We will ensure that the stakeholder participation that is necessary takes place, stakeholder management takes place. We'll ensure that the necessary institutional and organizational collaboration against the system happens, but more specifically, we'll ensure that the resourcing of the PCA is something that is real. The second thing that we think we are required to do in our policies to make sure that we lay more and more emphasis on behavioral issues. Matters such as beliefs, such as attitude, such as mindset, especially if you look at gender-based violence, if you look at programs for youth development and employment creation, because we believe that a lot of the youth become victims of gender-based violence, they become victims of sexual misconduct, especially by adults, and as a result, we get more and more new infections joining the queue. So that in a nutshell, Program Director, and in a very, very practical sense, our large focus is going to be the effectiveness of the PCA. Our focus is to make sure that in our programs, we do what it matters to influence behavior, to infuse behavior in our policies, particularly targeting young people with regard to their development, but more importantly, with regard to youth employment. Thank you very much, Program Director.
Let's clap hands for the Professor. Premier, thank you very much. We've recognized Honorable Musinogi MEC for DDECT, but we're also joined by Colonel KG Kihakilwe, Commanding Officer, Area Military Health, Northwest, who's also representing the Lieutenant General Dabula, National, who's not here. You are welcomed, Colonel. Matso for Military Health Service. Thank you very much. Now the program is as follows. The Minister of Health will come here. When the Minister of Health calls the Deputy President, Imbongi will stand. When the Deputy President finishes, the UKZN, Zululand, University of Zululand, ni behave, niziphathe kahle nihambele, ziphatheni kahle. I-University of Zululand izawube ikwelitala kwesi stage. I-conductor or i-manager yayo izoza ngapha izothatha isipho esisuka ku-Deputy President, sipho eso owayesipromise e-KZN kwi-World AIDS Conference ngenxa ye-performance ne-message yekhwaya ye-University of Zululand wayipromisa uDeputy President akahambe epromisa angenzi. Uba uyapromisa uyenza emveni koko. Ku-Mr. Delivery ujoyinile ku-president kwi-program kakhawuleza. Le nto nizayinikwa niyisebenzise for i-message. Minister of Health Dr. Mkhize on stage.
Program Director, MEC Sambata. Thank you. His Excellency Deputy President Mabuza, the Premier of Northwest, Professor Mkhize, the Deputy Ministers, Honorable Pasha, Ukupane Zulu, and Pinky Mloi, the Executive Mayors of Dr. KK District, Councillor Barre Musiane Sekhoto, MECs, Members of Parliament, Members of the Provincial Legislature, Mayor of Matlosana, Councillor Khaile, Hoshi Mabe, and the members of the House of Traditional Leaders, COSATU representative, the Secretary, Mr. Kupano Kunopi, SANAC Deputy Chair Steve Litsige, and the Chairperson of the Civil Society, Ms. Ndugu, UN Undersecretary and Executive Director of UNAIDS, Ms. Winnie Biamyema, and other members of the UNAIDS family, UN family, the UN Deputy Chief of Mission, Mr. David Young, representatives of PEPFAR, Global Fund, Health Executive at Harmony, Dr. Tumi, representatives of people living with HIV and AIDS, our international partners and local partners, civil society, managers at health and healthcare workers, members of the media and the community. Today there's a very special World AIDS Day. We believe that the winds of change are blowing in our favor. We are now sailing into a direction where there's a future where HIV transmission is showing evidence that is stagnating towards the end of the epidemic. This is a tale of global solidarity and multi-sectoral collaboration where nations come together with one common purpose, and that is to fight and defeat HIV and AIDS. However, there's a lot of work that still needs to be done. We can't beat this disease and all the social determinants of diseases that are associated. We have to embrace the national health insurance and make sure that we create a very strong and resilient system of access to good quality health care, where all of us have got that equal access to quality health care to deal with the rising tide of both non-communicable and communicable diseases. My visit to Klerksdorp Hospital has given me even more hope. This is the hospital where the first patient with multiple drug-resistant TB was treated. They've told us a story of how multiple drug-resistant TB has reduced from many years of hospitalization, such as 7 years, 13 years, to a few months. It does tell us that we're on the right direction. In 2018, we estimated 7.8 million people were HIV positive in South Africa. Currently, 5 million of those are already on treatment, 4.8 in the public sector, and the rest is on the private sector. We're determined to get, by the end of the year, a total of 2 million more people to be able to be treated on HIV treatment. We're also determined to achieve the goals of the UNAIDS of 1990 that we have spoken about, of making sure that people living with HIV know their status, 90% of them, and that those who know the status are on antiretroviral treatment, and those who are on treatment are immunosuppressed at 90%. We are confident that we'll be able to reach this target. Already on Wednesday, we announced 3 districts in KwaZulu-Natal that have already reached the targets. That's the district of Ugu, Mkhize, and Umzinyathi. It's also fitting that we chose Ugu to go and launch a new drug which we call a combination drug TLD, consisting of tenofovir, lamivudine, and dolutegravir. This new innovation has brought in a treatment that has reduced the chances of getting resistance, as well as reducing the side effects and improving compliance of all those who are on it. We therefore are saying now, the scientists, the researchers, the health workers, the patients, the people living with HIV and AIDS, communities have worked together with government to turn HIV and AIDS, stop it from being a killer disease to become a chronic disease like any other. That for us is a huge sign of progress. And the message is, no one should die of HIV and AIDS and TB, not today. And we have all the necessary ammunition to stop anyone from dying from HIV, AIDS, tuberculosis, and other related diseases. We need to work together to make sure that all our people are tested. The message is that we must all get tested so that if we are found to be positive, we take treatment immediately so that we can convert to HIV and AIDS from being a killer disease to a chronic disease. All the people that have been treated in the Clerksdorp Hospital with multiple drug-resistant TB, most of them were actually HIV positive. It therefore follows that if you can treat and cure someone of multiple drug-resistant TB when they've got HIV, it means we can treat anyone. But it means there is no more reason why anyone should therefore be dying. We will work hard with our partners to ensure that by March 2020, another 14 districts have reached the target of 1990. Unfortunately, none of those districts are in the Northwest province. And I'm making a point and underlying because I want to challenge the community here in the Dr. KK to work with us and maybe prove us wrong and give us a surprise and reach those targets. Right now, Dr. KK region stands at 90, 70, and 85. Of the 106,000 people who are HIV positive, 97,000 know their status. And of those, 58,000 are virally suppressed. And we are here to say to you, you can do it. Let's just go all out and make sure that everybody gets tested and start treatment, because if we do so by March, we will have been able to reach the target of 1990. It is not far, but reaching that target is not the function of the Deputy President, the Minister, the government, or health workers. It is the duty of the entire community. Each and every one of us must go out and fight at that level. We're very grateful today that the Deputy President is going to be inaugurating the Provincial Council on AIDS. It was unfair that this province was left behind with a non-functional or dysfunctional or non-existent AIDS Council. It is important that this council must mobilize the entire response on HIV and AIDS. It is also important that we must work together to support the national health insurance, because that is another strong armament in our fight against HIV, TB, AIDS, and all other diseases. Today, we are hosted by the Deputy President, who is the chairperson of SANAC and is the one assigned to lead government response on this matter. Many of us know him as a teacher who was involved in the struggle and became part of the first government in Mpumalanga in 1994, having played a role as an MEC in various departments: education, roads, transport, housing, agriculture, before he became the premier of the province. We also know that he has been the chairperson of the African National Congress and has now been elected in 2017 the Deputy President of the African National Congress. Colleagues, friends, ladies and gentlemen, comrades, please rise as we welcome the Deputy President of the States, the Republic of South Africa, His Excellency David Mabuza. Ezandleni, matsogo.
Thank you very much.